Hello everyone, now let us discuss about 2023 ICD 10cm coding guidelines for adverse effects, poisoning, underdosing and toxic effects. This comes under chapter 19. So the codes in the category T36 to T65 are combination codes that include the substance that was taken as well as the intent. The substance as well as the intent. Intent means whether it is accidental or intentional in such way. And no additional external cause codes are required for poisoning, toxic effects, adverse effects and underdosing of drugs. This is an important point. You should not use external cause codes for poisoning, toxic effects, adverse effects and underdosing of drugs. And some of the other guidelines are: do not code directly from the table of drugs. You can find the codes in the table of drugs. Do not code directly from the table of drugs and chemicals. Always refer back to tabular list. After finding the code in the table of drugs, you must go to the tabular list for complete description. And use as many codes as necessary to describe. Use as many codes as necessary to describe completely all drugs, medicinal and biological substances. Suppose if there are two or more drugs, then you must, if they have specific codes, then you need to assign those two codes. And if the same code would describe the causative agent. The next guideline is if the same code would describe the causative agent. If the same code would describe the causative agent for more than one adverse reaction, poisoning, toxic effect or underdosing, assign the code only once. If same code would describe the causative agent for more than one adverse reaction, then you need to assign only one code. That is, for example, nausea and vomiting are present and they are side effects for, let us suppose, metformin. And in that case, you need to code nausea and vomiting and additionally adverse effect of metformin only. So because this is the causative agent for more than one adverse reaction. Here nausea is one adverse reaction and vomiting is another adverse reaction. Next guideline is if two or more drugs, medicines or biological substances. If two or more drugs, medicines, medicinal or biological substances are taken, code each individually unless a combination code is listed in the table of drugs and chemicals. If there is individual code, then you need to code individually. And if multiple unspecified drugs, medicinal or biological substances are taken, this is an important point. If multiple unspecified drugs, medicinal or biological substances are taken, then assign the appropriate code from category T50.91. That is poisoning by, adverse effects of and underdosing of multiple unspecified drugs, medicaments and biological substances. This is the code. Now, the occurrence of drug toxicity is classified in ICD 10cm as follows. Toxicity can result in adverse effect or poisoning or underdosing or toxic effects. The drug toxicity may be due to, this drug toxicity may be due to an adverse effect or poisoning or underdosing or toxic effects. Now let us discuss in detail about what is adverse effect, what is poisoning, what is underdosing and what are toxic effects. Now coming to adverse effect, an adverse effect is nothing but a side effect and every drug will have couple of side effects. So whenever coding an adverse effect of the drug that has been correctly prescribed and properly administered, assign the appropriate code for the nature of the adverse effect followed by appropriate code for adverse effect of the drug. For example, in simple words, the condition should be coded first, followed by the adverse effect code. Adverse effect code should always be coded SDX. That is, it is a secondary diagnosis, not a PDX. And poisoning codes, in which the adverse effect is included, they have an associated intent. That is the reason in the initial we have said they are combination codes, which include the causative substance and intent. Associated intent as their fifth or sixth character. In some cases it is fifth character and in some cases it is sixth character, which govern whether it is accidental, intentional, self-harm, assault, undetermined, adverse effect or underdosing. So depending upon the scenario, you will select appropriate fifth and sixth character, fifth or sixth character. Examples of nature of adverse effects are tachycardia, delirium, gastrointestinal hemorrhage, vomiting, hypokalemia, hepatitis, renal failure and respiratory failure. Now let us see an example. Patient presents with persistent cough since 3 days. The past medical history indicates hypertension and diabetes. And recently an AC inhibitor was added to her medication list. Patient was advised to discontinue the AC inhibitor due to cough. Return to clinic after 1 week. In this scenario, the patient is presenting with persistent cough. This is the condition or nature of adverse effect. And the reason for this adverse effect is the drug AC inhibitor that the physician has confirmed. For that reason, the physician is indicating discontinuation of that drug. So the appropriate codes here are: first, the nature of the adverse effect, that is persistent cough. PDX should be R05.3, which is nothing but persistent cough, followed by T46.4x5A, which indicates adverse effect of angiotensin converting enzyme inhibitor. Seventh character A indicates initial encounter. Here the sixth character phi indicates it is adverse effect. Now coming to poisoning. When coding a poisoning or reaction to improper use of medication, example overdose, wrong substance given or taken in error, wrong route of administration, etc. First, assign the appropriate code from the category T36 to T35. Whenever we are coding the poisoning codes will take the precedence and they are coded as PDX, whereas adverse effects, they are considered as SDX. Poisoning codes have an associated intent as their fifth or sixth character, that is accidental, intentional, self-harm, assault or undetermined. If the intent of the poisoning is unknown or unspecified, code the intent as accidental. This is also an important point. If the intent of the poisoning is unknown or unspecified, then you need to code accidental intent. You should not code undetermined intent. The undetermined intent is only for the use if the documentation in the record specifies that intent cannot be determined. So for unspecified, you need to code accidental intent. And use additional codes for all manifestations of poisoning if there is also diagnosis of abuse or dependence of the substance. Then the abuse and dependence code should also be assigned. So first poisoning code should be given, then associated manifestations, and if there is any abuse or dependence, then those codes should also be given. Here the PDX should be poisoning code. Now let us see some of the examples of poisoning. Error was made in drug prescriptions. The errors made in drug prescription or in the administration of the drug by provider, nurse, patient or other person. That is, instead of prescribing one drug, if the physician prescribes another drug, instead of taking it intravenously, if the patient takes orally. So that is errors in drug prescription. Second is overdose of drug intentionally taken. If an overdose of drug was intentionally taken or administered and resulted in drug toxicity, it would be coded as poisoning. Third is non-prescribed drug taken with correctly prescribed or properly administered drug. For example, some of the chronic condition drugs and antibiotics, if they have any drug interactions. Here the antibiotic the patient is taking without prescription, whereas the chronic conditions are prescribed. Even in that case also, poisoning can occur. If a non-prescribed drug or medicinal agent was taken in combination with a correctly prescribed and properly administered drug, any drug toxicity or other reaction resulting from the interaction of two drugs would be classified as poison. Next is interaction of drug and alcohol. Certain drugs, they have drug interactions with alcohol. and when the reaction results from the interaction of drug and alcohol, it would be classified as poison. And those drugs should not be taken along with poison. So without knowing if the patient consumes that drug and alcohol, reaction will occur, and this is also considered as poison. Now let us see an example. A type 2 diabetic patient found down with diabetic coma, brought into ED and treated for hypoglycemia. Insulin pump was found to be malfunctioning and overdosing. So overdosing will lead to poisoning. In case of insulin pump malfunctioning, first the PDX should be T85.416. A indicates initial encounter, which is breakdown of insulin pump initial encounter, followed by T38.3X1A. Here the poisoning code is coded before the condition. Condition is hypoglycemia. The reason is poisoning. So the poisoning code is coded first, T38.3X1A, poisoning by insulin or oral hypoglycemic drugs, accidental or unintentional, followed by E11.641, which is nothing but type 2 diabetes mellitus with hypoglycemia. Now let us discuss about underdosing. An underdosing refers to taking less. Under means taking less of medication that is prescribed by the provider or manufacturer's instruction. Suppose a physician prescribed 1000 mg tablet. If the patient is taking only 500 mg, that is taking less amount than the prescribed amount. That is also considered as underdosing. Second point, most important point, is discontinuing the use of prescribed medication on the patient's own initiative is also classified as underdosing. Suppose a patient stops a medication by himself or herself without the instruction of a physician. Even that can be considered as underdosing. And for underdosing, assign the codes from the category T36 to T15 with 5th or 6th character 6. This is standard for underdosing. And the recently added new guideline is documentation of change in the patient's condition is not required in order to assign an underdosing code. For example, in the previous slide, we have discussed about overdosing of insulin pump. The patient is suffering from diabetic coma. There is an alteration in the physical state of the patient. But in order to assign an underdosing code, documentation of change in the patient condition is not required. That is, a patient can be normal and healthy. Then also you can assign an underdosing code. Documentation that patient is taking less of the medication than the prescribed or discontinued the prescribed medication is sufficient for code assignment. This is recently added. And the codes for underdosing should never be assigned as PDX or first listed codes. Codes of adverse effects and underdosing should not be assigned as PDX or first listed codes. If the patient has a relapse or exacerbation of medical condition for which the drug is prescribed because of the reduction of the dose, then the medical condition should be coded first. Additionally, non-compliance, that is Z91.12, this is further expandable, Z91.13, this is also expandable, and Z91.14, or complication of care, which is given by the codes Y63.6 to Y63.9. Codes are to be used with an underdosing code to indicate the intent if known. Whenever there is any type of non-compliance, you can add the non-compliance codes. Now let us see an example. Diabetic patient presents with hyperglycemia. Here exacerbation of condition. Patient is diabetic and is presenting with hyperglycemia with fasting blood sugar levels of 450. Patient reports with non-compliance to medication and patient is on metformin and Lantus. She is not taking Lantus since 3 days. So the patient was advised to maintain compliance to medication. Here there is no alteration in the physical state. That is, patient is presenting with hyperglycemia and fasting blood sugar levels are 450. So first the condition should be coded. So E11.65, which is type 2 diabetes mellitus with hyperglycemia, followed by T38.3x68, underdosing of insulin or oral hypoglycemic drugs, followed by Z91.128, which indicates patient's intentional underdosing. Patient herself is not taking Lantus. Patient's intentional underdosing of medication regimen for other reasons. Now let us see one more example. A patient presents with intractable epilepsy due to subtherapeutic, that is below the therapeutic levels, dilantin levels. And the patient has been non-compliant with medication for religious reasons. Here also first you need to code the condition. That is G40.919, epilepsy unspecified intractable without status epilepticus, followed by adverse effect of dilantin, underdosing of dilantin, that is T42.0x68, underdosing of hydantoin derivatives, initial encounter, and Z91.128, patient's intentional underdosing of medication regimen for other reasons. Now let us discuss about toxic effects. So when a harmful substance is ingested or comes in contact with a person, this is classified as toxic effect. And the toxic effect codes are in the category T51 to T65. And the toxic effect codes have an associated intent: accidental, intentional self-harm, assault or undetermined. Accidental, intentional, self-harm, assault and undetermined. Toxic effects are for non-medicinal substances. This is important. Toxic effects are for non-medicinal substances. And toxic effects should be sequenced first. So poisoning and toxic effects, they should be sequenced first. Whereas adverse effects and underdosing, they are sequenced as SDX. Toxic effects should be sequenced first, followed by codes for all manifestation. And when no intent is indicated, you should code accidental. Undetermined intent is only used when there is specific documentation in the record that intent of the toxic effect cannot be determined. Now let us see an example. A 28-year-old male presents with dizziness, nausea and vomiting as toxic effects of prolonged exposure. Here the conditions are dizziness, nausea and vomiting due to toxic effects of prolonged exposure to natural gas fumes from a hot water heater. And this was found to be due to hose leak. And what should be coded? How should this be coded? First, the code for toxic effect is the PDX. So T59.891A. Toxic effect of other specified gases, fumes and vapors, accidental, initial encounter, followed by R11.2, which is coded for nausea with vomiting, unspecified, followed by R42, which is given for dizziness and giddiness. By this we complete the adverse effects, poisoning, toxic effects and underdosing. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.